Hello. Do you need to know more about Medicare Part B excess charges? What it is, how it works? Should you be concerned if your coverage does not cover Part B excess charges? Stay tuned. Hello, this is Billy Williams, Medicare Health Insurance Options. Going to make a quick video today talking about Medicare Part B excess charges. What is a Medicare Part B excess charge? You may be doing some research about Medicare Part B excess charges. You might be considering a Medicare supplement plan that does not cover the Part B excess charges, for example, a Plan N. And you want to know if this is an important thing, if this is something to be concerned about, is this something to be worried about? So to explain a little bit about how the Part B excess charge works is to understand how the claims process works when you receive medical care from a medical provider. If you go to a doctor or a specialist in a hospital, they're going to ask you, do you have Medicare coverage? And you will say yes and provide them with your Medicare card. The medical provider may also ask you if you have any secondary coverage, such as a Medicare supplement policy. And then at that point, you would show them the ID card that you received from the insurance company that is providing your secondary coverage. At this point, what happens is your doctor or specialist or hospital is going to send a claim to Medicare through software that is used to communicate with the Medicare system. Now, most doctors accept what's called Medicare assignment. If your doctor accepts Medicare assignment, this means that they have agreed in advance to accept payment in full from Medicare and your secondary company. If you have a provider that does not accept Medicare, this means that they do not agree to accept payment in full what Medicare is going to pay them together with your secondary company. If a doctor does not accept assignment, they are allowed to charge you in excess up to 15% over and above the amount that Medicare has approved for the services that they have provided to you. So the next question is, does this happen very often, and should you be concerned about having to pay Part B excess charges? The simple answer to that question is no. This is honestly something that very rarely ever happens. The majority of doctors and medical providers that accept Medicare do accept assignment. One recent statistic shows that approximately 96% of Medicare providers do accept assignment. We also recently received some statistics from Aetna, one of our major carriers, and they did some research and they were able to show that in the year 2016, 99% of the claims that they processed that were Medicare related were sent through the system as a doctor who does accept assignment. If you already have a Medicare Supplement Plan F or a Medicare Supplement Plan G, your plan already pays for Part B excess charges. However, if you might be considering moving to a Plan N, the Plan N does not cover the Part B excess charges. However, it is very rare that you're going to have a situation where your Part B excess charges are not covered. Even if you were to experience a situation where your Part B excess charges are not covered, the previous report that I mentioned that was provided to us by Aetna told us in the 1% of cases where excess charges were involved, the charge was less than $20. So it's very unlikely that you are ever going to experience a Part B excess charge. If you do, it's going to be a very reasonable and very affordable amount. Therefore, my recommendation is that you should not worry about Part B excess charges if you are considering a plan in. However, if you want to check that your doctor does accept assignment and that you will not receive a Part B excess charge, it is possible to check on the Medicare website to make sure. I'm going to go to the Medicare.gov website right now. We're going to take a look at the process that is used. It's fairly simple. You would go to the Medicare.gov website. You want to go to the section here where it talks about finding a doctor. Then you simply want to use the search criteria using a zip code and or the name of a doctor, and I'm just going to put in a common name here, Dr. Jones, in the Austin, Texas area. We're going to pull up some listings, and if you can see here next to their name there's going to be a green check. If you see that green check, this means that they do accept assignment, and you can make sure that you're not going to have to worry about any Part B excess charges. So to review, the Plan F and a Plan G Medicare supplement do cover Part B excess charges. If you have a Plan F or a Plan G now, or you are thinking about getting a Plan G in the future, you don't have to worry about Part B excess charges. If you have a plan in or you're thinking about getting a plan in, the Part B excess charges really are not a big concern that you should be worried about. If you would like to explore the possibility of moving to a plan in to reduce the cost of your Medicare supplement monthly premium, I would be very happy to take a look at that option for you. I am an independent agent. I represent many different insurance companies. I'm currently licensed in 34 different states. So if you would, please give me a call. We can take a look at your current coverage and the benefits and the premium that you're paying now. We compare that to the different plans in the marketplace, whether you want to stay on the same plan letter that you have now, or you might be considering changing to a plan in. We can take a look at that option for you as well. My services to you are always free, and I hope this information in this video has been helpful. Again, my name is Billy Williams. Our website is MedicareHealthInsuranceOptions.com. Our toll-free number is 800-499-1942.